Afternoon. This is Carson Hetty. I'm an account executive with Microsoft here in St. Louis, Missouri. Really appreciate you joining today. Very excited about this session. Today's session will focus on insights, analytics, and different types of reporting that health systems can leverage today. We'll be featuring Central Logic, a Microsoft partner, and also extensive wealth of knowledge between Matt and Barry with Central Logic. Matt has extensive career featuring work with Epic, and Barry has worked with several providers in the healthcare space. So really excited to showcase this today. So without further ado, I'm going to go ahead and hand it over to Barry.
Yeah, thank you, Carson, and thanks everyone for joining today. Appreciate the time you carved out for this session. I've got a slide deck that I'm presenting for those of you who can visualize your computer. Otherwise, those who are on the phone obviously can listen through as well. So when we think about data and analytics, I don't think there's a more important time in healthcare than right now as to when data and analytics plays a key point in our strategy, whether that's in operations and how we operate our facilities, or whether it's a strategic value in how we think about our future, both currently given what's going on with the pandemic event around COVID, and how we recover from that and move forward versus what our real future might look like in the landscape ahead of all of us in healthcare. We at Central Logic believe that a big piece of the core of that business and that data collection is built around and can be built around a transfer center strategy that gives real time visibility into the operations, both historically as well as currently, but also with a glimpse into the future with an appropriate analytics package. So we're going to take you through kind of a standard set of analytics that we typically see and work with hospitals and health systems to develop, and then at the end, hopefully, we'll have a little time for some questions at the end. So I'm going to jump right in here. I said I am. There we go. When we think about analytics, I think, oops, sorry. So when we think about analytics, we really think about how do you connect the power of unfiltered executive level KPIs with access and orchestration, and how do you do that back to your organization? So really, when you think about your transfer center, you want it to be the hub of activity for your organization. You want it to provide clarity around what's going on today versus what might be happening in the future, but also be able to understand historically what has happened and provide some baseline data around KPIs, so that as you think about your operations, whether it's service line or facility level or even provider level, how do you measure that from day to day, month to month, year over year? And that's kind of what we think about when we think about analytics and how best to use it. You also need to understand very thoroughly, what patients are you getting, whether that's by referring providers, whether it's referring locations, maybe it's a geographic area defined by specific zip codes, if you will, that you've targeted as your primary service area and a secondary service area. And then not only what are you getting, but what are you missing? And the transfer center data, when collected appropriately and logged, can definitely give you visibility into that and allow you to have some understanding on how to mitigate those opportunities that you may discover. And that's really extremely important to understand because, and we're going to show you some of this, but as we move through this deck, you're going to see the ability to drill down into a particular service line. And in that side, that service line may be a strategy around referring locations. There may be a strategy around certain providers, or maybe there's a strategy around a particular payer mix, or other classification that you're trying to gather up and regroup as you think about coming out of COVID and getting your revenue stream re-energized. So just want to set the stage there. I'm going to move here to the next slide. Matt, I'm going to, if you're good, I'll hand this one off to you and then we'll bounce. So
Sure. So, one of the big importance in terms of looking at analytics, especially from an executive standpoint, is visualization. Seeing the trends and projections to be able to understand growth patterns and make decisions from that standpoint. So often I've worked with a healthcare organization and they've said, "Oh, we have a capacity problem." And you say, "Okay, what does that mean?" And they say, "I don't know. Somebody told me I have a capacity problem." The ability to really drill down and see what that means is so important in terms of having that up-to-date information and being able to see what those trends are seeing, not only from an overall standpoint, but as we move into those service lines that Barry talked about that we'll get into a little bit deeper. Here you're seeing an example of some of that visualization, and this is very, very high level. Just some information to see trends across your organization. This is simulated data, obviously, but some things that aren't too dissimilar from what some organizations have seen. Replicating a year where, sure, you had a lot coming in, and this first drop is explainable by COVID. That immediately organizations were asked to basically shut down any non-critical services due to PPE consolidation, some other factors involved in that. So sure, we see an expected drop, but as we see that recovery happening here at the end of May, what is this second drop? And to be able to see that very quickly in real time is one of the keys to starting to understand those performance indicators. You'll also see a number of spots, and this is something that we also do throughout the platform, to include some indicators that we can compare to industry best practice. So some of the call out boxes that say things like, okay, in the last 3 months, these are cases that have come from external organizations. So it's not only seeing overall growth within the number of transfers coming into your health center, but how many of those are coming from the outside. And that's a good thing. That is potential patients that we can keep inside of our health system even after they've been discharged from an acute incident. And seeing that growth is an understanding of a healthy organization, what should be seen from that standpoint. Similarly, looking at total number of cases and then an indicator, and I realize it's a little bit hard to see on the screen right here, but that 92% indicates keepage. And so ways to track within the health system that patient is staying with you, whether it is, an acute episode ending up in an emergency department, or really leveraging your ambulatory health services through clinics and other health, healthcare that you have throughout your organization.
Yeah, and just to add to that, and Matt kind of touched on it as well, obviously the ability to grow volume is very highly dependent on your ability to have capacity and capability. And part of the very strategic value of analytics is to be able to look at data at a very high level and then drill down into those opportunities around potential capacity issues and or capability issues. I've actually seen health systems look at their data and determine that they're leaking a lot of volume around particular service lines, only to decide strategically there's value to maybe recruiting and putting in place service lines to fill the gap of leakage that they've experienced over time. Sorry guys, I'm having trouble with my, there we go. Yeah, so when we look at more detail, we start drilling down into the detail, and you start looking at your physician engagement, for instance. As you think about accepting patients or patients leaving your organization, there's a couple of leakage points that you really want to look at. Physician engagement with your organization is extremely important. It always amazes me when I look at consult with health systems only to find that a large portion of their providers are employed. However, there are gaps there are gaps or opportunities of leakage that are occurring because those providers either are consumed with their workload and unable to take more patients and are denying patients, or potentially they're sending patients out to their competitors, to your competitors down the street because of relationships with other providers. So the ability to dig into that data at a physician level and really take a look at who are your high performing providers as relative to the partnership that you have with them to feed your organization, and to look at those who are not performing really adds value to your typically your chief clinical officer or to your CMO or your service line leaders as they think about how to better manage your physician population and in the relationship that you maintain with them. And to that point, you can also take that data and drill really deep into the service line elements as well to determine, is this a service line issue around revenue strategy, or is it simply a gap that I have or a provider, a potential provider issue that I need to address?
And this really does a couple of things for your organization. Data really changes the conversation. When you're looking at accountability, it's not just, hey, everybody says this or people feel like this is a problem. Here are the concrete numbers. Here is how you are performing according to your peers. So let's have a conversation about what is preventing you from accepting more patients into the health system. That gets to meaningful action that can be taken as a result of the data, rather than arguing about, he said, she said, what the numbers are. The other thing that this can do for an organization, because this isn't necessarily a problem of accountability with the physicians. If 5 of the top 10 denying providers in your organization are orthopedists, it could indicate a cultural problem within that department, but maybe there just aren't enough beds. Maybe there are other things that are preventing those physicians from saying yes. And again, the data will allow you to dig into that before even having a conversation with those folks to see what some of those challenges are and the extent of those issues.
And as well as you look at the data, also looking at the locations, both the locations that are inside your health system, how much volume are you able to push into each location across your health system, for instance? And number 2, are you really leveraging your entire health system, or is all of your volume coming to a single quote mothership location, and the other facilities you have in your network are suffering with volume, and thus you might be losing patients because you're not appropriately load balancing those patients that are coming in to your health system appropriately across the system. That's a very important element, and it's, again, I'm often intrigued when I see that, when I see the occupancy rate of a large tertiary medical center at 75, 80% occupancy, with a high denial rate of they're denying a lot of patients, only to find out that the satellite locations in the same system within the region are at a 40% capacity, but have the same capabilities in some aspects. So there's a real opportunity to use that data and leverage a load balancing strategy across your organization, which ultimately puts all boats lifting up in the water, and thus your revenue lift is across your system and not dependent on one. The other thing to understand with data relative to locations are who's referring you patients. You have an outreach strategy, I assume. Most hospitals do, most health systems do. There's an outreach strategy to grow service lines. There's an outreach strategy to grow volume and to put some accountability, if you will, around those transfer agreements that each of us have in place. And as you look at that data around those referring locations, it's always great to look at what kind of volume am I accepting from those locations? Well, first of all, what kind of volume are they sending me? Secondly, what kind of volume am I accepting? Are they feeding me the service lines I want? And then we're going to show you another report here in a minute. Also, are we getting the right kind of payer mix from these referral sources? It's again, it's not uncommon as we go on site with hospitals for a hospital to say, well, I'm not concerned about the referral volume out of ABC Hospital because all they ever send me is just bad business. What we typically find when that occurs, when we dig into the analytics, is that's not necessarily true. There usually will be a few self-pay patients or Medicaid or whatever, but at the end of the day, if you have a strong outreach strategy, you have good data, you can validate that transfer pattern, and if needed, you have data in front of you to go have an educated conversation about the relationship and how to best manage that moving forward. There we go.
Nice. So this is one where it shows where some of that visualization is coming from in terms of lost cases by referring location. So, here is where you can really drill down and make informed decisions about the type of intervention that you want to have by service line, also by geography. So you see over here, you've got a little bit of a heat map about where these cases are being lost, with just a few mocked up examples there. But as you go down into the lost cases really by that service line, here you see at this first organization, they are turning away a high number of pediatric patients. Maybe that's appropriate within your organization. Maybe you're referring them to a partner site that you have with a pediatric hospital, and that's fine. And then you look at this and you say, okay, oncology is another of these, gastroenterology. And so what do we want to do here? Is that a candidate for a new service line at one of these facilities? Do we want to keep those oncology patients or those GI patients? Do we need to start a service line at, a clinic or a hospital in that particular geography? Before it used to be a lot of market research that had to go into this. Here, hey, okay, these are the type of patients that we're saying no to in these particular service lines. And so what action do we get to take in a very visual format, again, in order to have an impact on that area, keep some of those patients within our health system, and make sure they're not going to our competitors?
So when we look at the data further, and again, you have a heat map here, and this one here breaks the top service lines down a little more in detail. As you think about your service lines, it's important, particularly around your high value service lines, to know exactly what are you keeping, what are you getting net new, and then what are you missing. And as you look at that data, to Matt's point earlier, you begin to realize that maybe there are opportunities for service line growth and expansion. Maybe there's not. Maybe there's an outreach strategy around the heat map, if you will, that's displayed here. If I'm sitting in the center of this heat map, there's obviously some gaps of coverage that I'm not seeing referrals from. So is that an outreach marketing strategy that we put in place to move forward? The other thing I would say around this data is we have the ability to dig down into this as well and pull out things like how many of these calls that are coming in are actual consultations. If I'm getting consultation calls that are coming in and they're going to my cardiologist or my orthopedist or whichever service line you choose, I want to make sure that patient, if at all possible, is staying in my health system. And so not being leaked out to an outpatient surgery center potentially, or maybe even another competitive hospital. So as those calls come in, the ability to drill down into those and to track those patients, if you will, across the journey of their care through that consultative visit, it becomes extremely important. The other part of this also this data allows us to do is, if you think about a good outreach strategy, there's always the loop closure aspect of it. We all tend to follow the path of least resistance, first of all, but we also like to work with people we like to work with. So in healthcare, as we all know, one of the challenges is, hey, look, I'm going to send you a patient, but how do I ensure I'm going to get my patient back, or are you just going to keep them forever? And I can tell you, having worked in rural markets and the large markets both, the fear from the rural markets is I'm going to send my patient in and I'm not ever going to get them back. So as you think about using the data and being able to drill that down, the whole idea of closing the loop on your marketing and your outreach strategy to be able to go back out to that referral source and thank them for the referral because you have the data around it, and then to provide some clinical follow-up on how that patient's going to be handed back to them becomes extremely relevant from a business strategy perspective of putting some accountability around your referral partners.
And we work with organizations to define what these top service lines are. And essentially what this allows us to see is, looking at these and saying neurology, we're doing great there. Just a very small number of lost as compared to the number that we have acquired and retained. Whereas I look at, gastroenterology, and sure, the numbers might look good at first glance, but really we're losing more than we're retaining. What are the issues there? What's preventing us from being able to be successful? And again, allowing additional drill down into the information from that standpoint. I think we have a question from Joe Schmitz. At least I see a hand raised.
Yeah, absolutely. I was going to want to know, what was your refresh rate on your data here?
The data here, so this is a report that we have run and extracted. In terms of the refresh rate on the dashboards, they are basically real time. So just, a second or two behind from that standpoint.
Excellent. Thank you.
Yeah. So this is
sorry. Go ahead. Sorry.
This is where we get into some of the contribution margin that access centers have done themselves. We partnered with the University of Utah to do a study on the contribution margin per transfer within an organization to really help them visualize and see the contribution margin of their access center from a financial standpoint, tying an actual dollar amount to that. So we use information from that study to produce this information. If organizations have done their own study in terms of the contribution or the value of a transfer and the impact on the contribution margin, we can adjust the data so that it shows that according to their information. And then this is also some information that we pull in, using some of those additional sources that come into our information in terms of the uptime within an organization, the number of support tickets, how they're submitting those. So this tends to be a little bit less about, overall organizational health, but interesting in terms of our system performance and what the organization is opening tickets about, how they're submitting those, things like that. So it's information that's interesting from an executive standpoint, just in terms of using a system and what that means for our bottom line, and also what that means from the support services standpoint.
Yeah, and just to add some clarity to Matt's comments on the left-hand side of the slide, the financial impact. The blended rate here is $10,800 per case that you gain of EBITDA once that patient hits your organization through the transfer center. I bring that up because that's a blended rate done by the study conducted by the University of Utah. But what I wanted to say was, obviously what we've encountered as we drill down into service lines with organizations, there's a deeper dive we can take. That blended rate is a blended rate, but every organization is a little different in that space. And particularly when you start looking at individual service lines, particularly around high value service lines like cardiology, neurosciences, those service lines, particularly coming out of COVID, or coming through the COVID pandemic event here, we have found have become very important to organizations as they think about their rebound strategy on the revenue side of the equation. And so as we put these dashboards together for clients, we have the ability to drill down into those service lines, and working collaboratively with our clients, build in those EBITDA markers around those service lines based on the information you provide. The other thing that I would say to you guys that we have the ability to do, and we track for a lot of organizations, is case mix index as a totality. We typically will look at case mix index both on the medical side as well as the surgical side of the house, and then look at the blended rate, because we know that if we can drive transfers, or you can drive transfer volume around those high case mix index, high acuity service lines, it's going to drive your case mix up, and your blended revenue rate is going to be significantly enhanced by that type of initiative. So with that, I'll just kind of close up and just say that what we presented is a pretty high level of the analytics package that we typically get asked for from our executives that we work with throughout the country. Obviously, we have the ability to somewhat customize some of those based on the appetite of various organizations. One thing that is not in the deck that I will openly share with you guys, and that's around the whole COVID pandemic. We've done a lot of work with particularly in the state of Arizona, but with our health systems and our partners across the country around identifying COVID exposures in their facilities, as well as how to manage those patients across a network of care. Sometimes it's about capability, sometimes it's about capacity, and sometimes it's just a matter of building a dashboard around what are the clinical alert factors associated with each COVID patient, so that we are creating a safe environment ahead of that patient, both for the patient, but as well for the providers who are going to be receiving and caring for those patients. So that COVID dashboard has become an extremely important, valuable tool to our clients as well. So,
And
Matt?
yeah, to speak to the question that was asked earlier about the refresh rate and some of the timeliness of this analytics, that's some of the power of that COVID dashboard that we look at, and patient capacity, in the Arizona example, across a state for some of our large providers, across multiple hospitals and a health system. The real-time understanding of what their capacity is, the number of COVID patients that they have, where those patients are coming from in terms of zip codes, and being able to look at geographies is really powerful when you're looking at that from a real-time standpoint. That's not just doing a root cause analysis after the fact and saying, oh, where could we do better for the next one? That's decision making in the moment with data that's happening right in front of you in real time. And to be able to take action based on what you're seeing with that COVID data, what you're seeing as far as hospital capacity across your health system or across your state, really is a game changer for getting timely care to patients where moments matter. Yeah, with that, what questions do you have for all of us?
I really appreciated your comment earlier on load balancing. And I think so many organizations right now are in crisis mode on staffing with furloughs, layoffs. I think my biggest interest at this point is visually, how do we create that dashboard that provides us that regional wide view of our organization to see where we have staffing available, not only within local hospitals from department to department, but looking regionally as well. So if we have 5 locations within a 50 square mile area, how visually can we put that dashboard together to quickly recognize where we have staffing needs and where we can pull staffing to fill those needs?
Yeah, so Matt, I'll take first shot at this. So yeah, it's a great question and definitely a valid question right now, particularly as as you know, I'm sure you're experiencing it where you're having staff that are being exposed to COVID and whatnot, and so you have call outs and you have people that are mandatory time off, et cetera. We've found that staffing crunches have become quite prevalent. Um, the work we're doing with the state of Arizona actually addresses that. We have a dashboard that we created that the state looks at every single day, and they look at the hot spots of activity across the state and bounce that up against the availability of beds, which for them is we have a real-time feed of bed availability across all health systems in the state. And for the sake of this conversation, I'm going to call that a system of care, and kind of say a system of care could be, in that case, the entire state, or it could be 5 hospitals, right? So across that system of care, they have the ability to look at what beds are available, and those beds are timed in and out based on staffing availability, and then they are resourcing nursing staff and deploying nursing staff across the state of Arizona based on those hot spots and dashboard metrics that are created. It's become a very valuable tool for the state, and to the point they deploy nurses every day based on that dashboard that's again presented in real time.
And then from a health system standpoint, you can look at it on that granular level, but you can also kind of blow that up to more of the macro level from that standpoint. In some of these search situations, it's, our margins are razor thin. We know what's going on. So, every service line you need to furlough 10% of your nurses or whatever that might be. That's not the right approach here. To be able to drill down to specific information as far as where that capacity is concerned, or yes, we don't have as much in terms of this service line, but can we repurpose some of those nurses to other areas in the health system to deal with that additional load in that area like that. So you could see it from a government standpoint in something like Arizona, where they've really smartly put together this deployment of nurses to where they're needed across an entire state. But you can do something similar within your own health system and really make sure that you're still getting the margins that you need and getting that financial understanding of the impact of that and making sure that you're making informed decisions there.
Yeah, and just one more comment to that question. I think the thing we have to think about here in terms of a health system as well as a state or government or project is, we have the opportunity with the data to load balance two different things. We can load balance staff to the demand, or we can load balance the demand to the staff, right? So we see projects that encounter both, where we're actually, like the state of Arizona, where we're deploying nurses based on the demand or the lack of capability or capacity, into the demand. But we see health systems taking that same concept and load balancing the patients to where the staff are located. So the ability with the data to manage that becomes very fluid and very effective.
Yeah, great question. Thank you. Others?
Any other questions? All right. Well, first of all, let me say on behalf of myself and Matt, I think I'll speak for Matt. We definitely appreciate everyone's time today and welcome any questions you might have. You can obviously feed those through, I think, Cameron, or I'm sure we're all on an invite here. You can send us an email. We're happy to address. We definitely appreciate your time and the opportunity to speak with you, and hope this information was very helpful to you. Matt, you want to close us?
Sure. Yeah, similar to Barry, excuse me. Really thank you for being here and giving us some of this time. The real differentiator in a space like this that you're looking at access and orchestration within a health system is that information. Where are the patients coming from that are coming in? Are you keeping them or not? What are the service lines where you're struggling to bring people in or don't have the space to do so? And then where are you losing patients from within your health system? When you have a deeper insight into that information, that's where you can really start making a change and keeping those patients within your health system and allowing you to compete there in your areas. So thanks for letting us just show a little bit of information and really appreciate it.
Yeah, thank you so much for the session today, everyone. Appreciate everybody attending, and obviously the lively discussion as well. The great questions. As I mentioned at the onset of this, the call is recorded today, so if you'd like to get a copy of the session, definitely feel free to reach out. If you'd like to continue the dialogue, reach out as well. Obviously, data and analytics, specifically in real time, and some of the integrations that can be done with some of the EMRs and tools that you guys have in place today is paramount. So would love to continue the dialogue with you. But if there's no other questions, we'll go ahead and wrap. So thank you so much.